So this week we will be doing two chapters. Essentially, chapter 10 talks about healthcare information system standards. So these are standards that are outlined by the HHS or the healthcare department, the CDC, the CMS, all the governing bodies. Okay, so just sort of get a sense of who these bodies are, what are the standards, most important standards, because in the healthcare industry, because we're dealing with patient information which is highly confidential, the standards have to be maintained and strictly maintained. And just to understand the basic requirements, it is important to know the key terms, know the key standards. Okay, this talks about the facts, this chapter, so just read through it. Like, we remember one of the previous chapters, we talked about ICD-10 coding standards. That's very important. um, these are all different standards, different vocabulary, different names, nomenclatures. So read over it. You don't really have to memorize each standard, but just to get a sense of what these are. What does RX norm mean? UMLS, what does that relate to? Um, then what is HL7? What is DICOM? Things of that nature. Okay, so this chapter kind of gives you an overview of the standards. This is chapter 10. And then we talk about security, chapter 11. And security in healthcare is important again because of the nature of sensitive information that is floating around around. I mean, we're talking about patient information. I mean, so for example, if you're an employee of a company and you have a certain health condition that you don't want your employers to know, not that your work is being affected, but maybe if they get the information, you will be looked upon as differently. So that's sensitive information for you. So we talk about security. Just the basics, but the readings from this chapter, which I'll be talking about in just a minute, it talks about the different security issues. Now, HIPAA, like we touched upon HIPAA earlier in the course. HIPAA is basically the standard, the rules and the standards that allows you to protect, or allows protection of patient information. Okay, um, so um, generally speaking, there are certain administrative safeguards that you can apply, the physical safeguards, the technical safeguards, policies and procedures. HIPAA, the high-tech component in HIPAA, it's basically related to if HIPAA covers entity, business, health, high-tech covers basically anything, information that relates to digital information. Okay. Um, Talks about administrative safeguard procedures. So kind of a general overview of what are the safeguard policies and procedures in place uh, for hospitals, for payers, providers, whoever is a carrier of patient information or receiver of patient information, or is or supplier of patient information. Okay, whether it be it a pharmacy, a lab, a hospital, a clinic, the patient himself or herself, the doctor or the provider, the payer or the insurance company. And then you have these articles about privacy, concerns of security and privacy, all these in the context of healthcare information system. Okay, another article about hackers threaten. Recently, actually not recent, maybe a year back, Anthem, a company, a large pair, was their records were hacked, and that was a huge issue in the healthcare industry. As a matter of fact, the entire corporate America. So and that those instances like that have to be taken care of. Privacy in digital medical care and healthcare outside of HIPAA protection. So this gives you a sense, kind of glance into what HIPAA is and what HIPAA doesn't cover, what HIPAA covers. So this article right here. Okay, and then the fourth one here is kind of reassessing your security practice in the healthcare environment. As we say in technology and security, people say cybersecurity, security. Hackers are getting smarter every day. So people who basically invent security technology or cybersecurity technology also have to be a step ahead of hackers. So kind of you have to reassess what your security practices are, what are the safeguard policies that you have in place, and continue to improve, because hackers are improving, or hackers are becoming more smarter every day, so you have to continue to improve. And it's a basically it's a cat and mouse game, and you got to be ahead as the person who's the implementer and the safeguard one who provides the safeguard. So that's kind of the gist of this week. Security standards, and gives you a sense inside. HIPAA is the main overarching regulation policy, if you will, for this whole putting in practice the security and privacy of health information. High tech is a component of HIPAA. So these things you just should take out of this week's readings and chapters, the two chapters that I just showed. Thank you.